Hi, my name's Rebecca. I'm a doctor in natural medicine, and I thought I'd jump on today and talk about my long haul journey with COVID because there's not a lot of information out there, and I've been doing extensive research. As always, I'm my number one client, so what I go through helps me then with my clients. So I just wanted to tell you that you're not alone if you're suffering long COVID and it's not in your mind. In case anybody's told you, or if the doctor has told you that it's not true, or that just to basically get on with it, which I've heard reports from other people, it's it's not the case, and you're in rehabilitation if you're in long COVID, and you do need to have support and help. And I would also recommend those of you that are suffering with long haul COVID and you haven't seen the doctor to ask for extensive blood work, ask for an MRI check, see if there's anything else that's been triggered physiologically from having the stress on your body from having this virus. I will just list some of the symptoms that I had during COVID, which were not pleasant. I had COVID in July 2021. No, sorry, June. And I had quite a lot of symptoms. My partner had it and my son had it. And they got better, but I continued to get worse. I had a 39.8 fever for like 3 weeks. I had to go to the hospital for a couple of times for respite. They were mostly checking my lungs and making sure that that was okay. And luckily, I didn't have any respiratory issues, and my lungs, my organs, like all the organs in my body, were just very fatigued. And now I have a lot of palpitations, and mostly for me, the pain in the body and the heart issues are what's bothering me the most. So I'm just going to list for you some of these symptoms, so maybe you can recognize them in yourself. Extreme fatigue. So some days I couldn't even lift my hand. It would be a similar kind of thing as chronic fatigue. I'd have neurological issues like pins and needles in my hands, not being able to move my arms and shoulders and neck. I had this strange taste in my mouth. So while I had COVID, I had a really distinctive taste in the mouth. It was gross. And we know now that COVID is not just a coronavirus, it's also a neurological virus. It attacks the cranial nerves straight away through the olfactory system, and attacks the nervous system. So we know that it's a neurological illness. Obviously, losing sense of smell, that's coming back, but not as strong as before. A lot of brain fog, confusion, light intolerance. I was shaking sometimes. I had menstrual disturbances, GI issues, bloating, gassing, that kind of thing. Joint pains. My hair will not stop falling out. It's ridiculous the amount of hair that falls out. Anxiety, sometimes insomnia. And these are just a few of the symptoms. Also had urticaria, the hives, palpitations, pain around the heart, gases, and that kind of thing. So if you recognize those symptoms, if you're suffering with them as well, I'm just going to share with you now a few things that have helped me in my rehabilitation from COVID, because I thought that I'd fully recovered, and then what happened is it just came back in a wave, and then it's been coming off and on in waves. So I drink a lot of water. I carry this huge bottle around with me, and it's a really simple thing to do. But I've been having POTS, so especially if you're experiencing palpitations, when you go from seating to standing up, you get pools of blood in your lower limbs, so it affects your heart rate. That's something that you can counter with by drinking lots of water, 3 litres a day. If you can, do broths and soups and things to get lots of liquids in, because you also want to keep your salts up. So I use a lot of salt, Himalayan salt, and I also like to take electrolytes because that also helps keeping the body energetic. And it's something that most people can tolerate. It's keeping the hydration in the body, keeping it active. Another thing that I do is I wear this watch to keep checking on my heart rate and just making sure so that I'm monitoring myself and pacing. So in the past, I would be really quick, like seeing clients back to back or just busy, pushing the pushchair around. I've got a 2-year-old son. So now I'm just pacing myself, doing less physical exertion. I actually started Pilates instead, and I'm doing Pilates gently now to help me recover. And just pacing throughout the day. And there is, if you look online, there is a diary that you can keep. So it's like a pacing diary for rehabilitation, and you can track, whether or not it's a mental exertion or a physical exertion, and what you're actually doing throughout the day so that you can monitor it. Another thing that I've come to the conclusion is that maybe I'll do a follow-up afterwards, because I'm doing some MRI scans at the moment just to make sure that there's no physiological issues. But from what I can gather, I'm theorizing this, that COVID, because it's such a huge stress on the body, that it triggers it into autoimmunity, basically. So I'm thinking that I might have a mast cell activation going on at the moment, and it was underlying from before. It could be from many different things: stress in early childhood, exposure to mold, allergies, multitude of things that could result in the expression of that microbiome, for example, if somebody's got leaky gut, but then obviously viral infections post-viral. So I've just started a low histamine diet. That's helping. So low histamine diet is an anti-inflammatory diet. If anybody wants, I can also do a video about that and talk about an anti-inflammatory diet. And some other supplements that I'm taking. I don't want to mention supplements too much because we need to do diagnostic first. You need to do some tests, some blood tests, to check these things. I mean, you can work with a lab and get the diagnostic to see if you're intolerant to histamine, which is what the mast cell activation can produce. Or you can do some, for example, I've got a list of lab work that I'm about to run, which is the test for the DAO, which is the diamine oxidase, just to see if that's deficient. That's the enzyme that breaks down histamine. So in case that's an issue, you could also do a test for tryptase. If you find a functional doctor in your area, will be able to help you with this. Or maybe I might even try to see if there was any allergies triggered as well from having the COVID infection, and just seeing if there's any underlying things that are just preventing me to full recovery. So the things that I've been working on taking, during the infection, I took some vitamin D. I wouldn't recommend taking vitamin D all the time. Again, you want to be precise and specific about your supplements. So you want to really check how a micronutrient panel blood works, so that you can really check where you're deficient and then supplement based on that. But in general, the things that most people are magnesium deficient, for example, 80% of the population. So helping your body with some magnesium really helps, and obviously vitamin C. Things for your hair like selenium can be useful. I also recommend tryptophan because it's quite depressing as well. If you're Tryptophan is an amino acid that just helps with mood regulation and sleep, and it's a precursor to serotonin, so it's often something that can help you feel more joyful. And quite often, if you've been if you're going through COVID as well, just going through the pandemic, it's quite challenging. So you could try tryptophan, which is something that you need to take a B vitamin, B6 with, but most brands will actually already have it combined. Another thing that I created was the Anxiety Rescue, which I created for my doctoral thesis during the pandemic, which was a quantum approach to treating anxiety and depression during the pandemic. And I created that because I saw a lot of my clients were really anxious. My dad was quite ill. He was in hospital with COVID, and there was a lot of anxiety and a lot of stress. So I wanted to create some simple mind-body techniques that could just help people overcome the symptoms of anxiety and depression. And in fact, everybody that did the program, completed the program, or reduced their symptoms to normal range. So if anyone is interested in doing the Anxiety Rescue, I'm offering that, and I'll put a link or the details down in the description box. And I might continue this journey once I get some more information around my long haul COVID journey, because again, we're just discovering things all the time. We're trying to understand and learn and heal. So hopefully I will jump back on here at some point and give you an update. But meanwhile, if you are suffering with long haul COVID, just feel free to reach out to me. You can message me through my website, and I will do everything I can to help support you with that. Okay.